Okay, this one should be a short one, all right, but we're going to do a little review at the end of this. So I'm just going to go ahead and throw it up there. You know what the deal is, joeyjohnsondo.com. Go there, donate your $3, please. All right, something I didn't talk about was my mnemonic for measles. I just wanted to highlight this. Okay, notice that I have two M's here and two S's there. All right, measles can cause malaise and fever, maculopapular rash, eye conjunctivitis, auditory otitis media, spots in the mouth, which are your complex spots, lung infections, either primary or secondary, encephalitis, that's usually post-infection, stillbirth, or SSPE, which is subacute sclerosing subacute sclerosing panencephalitis. That's going to give you upper motor neuron signs if you get that. Okay, it's not very common, but just to throw that in there for completeness. All right, so now RNA helical segmented. Remember, if they're icosahedral, we did non-enveloped versus enveloped. If they're helical, we're doing segmented versus non-segmented. Okay. All right, and so we're going to tie it all together at the end of this. So let's go through this. So if you want to remember the non-segmented, there are several different mnemonics. One that I remember is Sabor, like that, okay? And so like you savor the flavor or something like that. Okay, the S is for segmented, that's why it's small. All right, and then for the rest of them you have right here, you have arenavirus, bunyavirus, you have ortho myxoviridae, and then also we've got the R just to remind you that it's RNA. Something else that I've seen people do, and this might be one that you might want to use, is BOR. So that's for bunyavirus, ortho myxoviridae, and arenavirus right there. All right. And remember that they are RNA and they are segmented, so you might want to say BORs with an S at the end of it. So let's go ahead. So orthomyxoviridae, that's going to be your influenzas A, B, and C. You get antigenic shifts, which are pandemics, and drifts, which are local outbreaks. If something kind of drifts, like you're drifting off to sleep or in the car, then okay, you know, you're varying a little bit. But if you have a whole dang shift, then it's like, oh crap, you just shifted lanes, you're going to die. Or, you know, like, oh, you know, he's drifting off to sleep. Oh crap, you know, he just shifted his whole position. You know, he used more muscles, all right? So this is what you're going to get the flu from, influenza. I actually had a board question before, said, which of the following can cause the flu? And it had Haemophilus influenza on there, okay? The flu is not caused by Haemophilus influenza. It is caused by the virus influenza, okay? And so this is spread by aerosols. You're going to get your IVIRs in this, if y'all remember that. If not, go back to your antivirals drugs, okay, your IVIRs, if y'all remember that, okay? And so alternates you can give is amantadine or rimantadine for the flu A only. The disease it causes is the flu. You know, you get your normal stuff, your fever, headache, running your stuffy nose, watery red eyes, cough, myalgia, fatigue. I feel like I'm in a commercial saying that. You hear it so much, okay? And kids, you can also get diarrhea or abdominal pain. Keep that in mind. Don't give a kid aspirin. Do not give them aspirin. You can give that kid Ray's syndrome, all right? And vaccines, each year they try their best to get these antigenic variations. Sometimes the shifts occur every 20 years, and drifts can occur every year, though, okay? For instance, influenza, it can actually break up into 8 different segments, all right? That sucker is very variable, all right? And you could think like an influential politician is in office for all 8 years. They got voted in twice, maybe if they're president. So that orthomyxoviridae is the one that can break up into 8 segments, okay? Bunya virus over here, you got the hantavirus. So this is spread by rodents. Rodents will have this, and humans can get it through a mosquito bite, or sometimes, you know, if you actually don't take care of the urine, you know, sometimes when we trap mice in mouse traps and then you don't properly dispose of them, all right, you can have the urine and feces that are improperly cleaned from your caught mouse, and there you go. Now you've got, you know, possibly hantavirus, all right? That sucker can cause encephalitis. Something to remember about this, sometimes it's called Korean hemorrhagic fever. You can get the flu followed by bleeding if that happens. Sometimes you can get hypotension and renal failure, all right? Hemorrhagic fever with renal syndrome. This is the one I was telling you about. Remember I said that we'd talk about it a little bit on the last lecture. So if you get hemorrhagic fever, all right, and you have renal symptoms with it, you are thinking hantavirus. All right, you can get pulmonary symptoms with this. This was once called the sin nombre virus. Sin nombre, yes. Sin means without, nombre means without a name. This is without a name virus, all right? It's relatively kind of new when we started giving it a name back in the 90s, but don't quote me on that. I think that's what it is. Anyway, flu symptoms followed by acute progressive respiratory failure. Mortality rate is approximately 40% in this, and it can progress to death within 10 days, all right? And so one time one of my friends said, hey, I'm having trouble remembering that the rat is with hantavirus, so I tried my best to tie it all in. You've got Paul Bunyan. See a little round bunion right there? And notice that, by the way, bunion and arenas and circles. Why? Because, hey, we don't have cojones in this picture, so I drew circles. And remember, the other circle has the little delta sign, okay, HDV. But anyway, so you got Paul Bunyan. He's holding up a bunion on his foot or hand or whatever. It's round and circular, and he's got a rat. Why? Because he got rid of Babe the Blue Ox. See Babe the Blue Ox right down here? Babe the Blue Ox is dead. Paul Bunyan upgrade it to a dancing rat. All right, why is it a dancing rat? Because y'all know that little Fanta commercial where the little hula girls are like, Fanta, Fanta, don't you want a Fanta, Fanta? So Paul Bunyan's laughing. He's like, ho, 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 I think that's cute. This little dancing rat is going, Hanta, Hanta. You don't want to get Hanta, Hanta from me because I'm a rat, right? All right, so Paul had Baby Blue Ox. It died. And I feel like I'm somewhat sacrilegious, man. This is like an American tradition, Paul Bunyan and Baby Blue Ox. I'm sorry. But anyway, so he gets the little dancing rat. This Hanta, Hanta. You don't want to get this Hanta, Hanta, because I'm a rat. Anyway, arenavirus now. So you can get hemorrhagic fever and hemorrhagic shock with arenavirus as well. The specific virus under that is going to be the Lassa virus. All right, just like that, causes hemorrhagic. That's the L in you held blood. All right, and so it's spread via rodents contaminating food or water. You will treat that with ribavirin. All right, and so without further ado, let's get done with these DNA and RNA viruses. Let's do a quick quiz. Okay, so DNA. If y'all remember, what are the characteristics of DNA? Do you know? And y'all can pause it after I ask each question because I'm not going to hold up for you to answer. All right. D for double-stranded. They're all double-stranded except for one exception. N is for non-polar sense, like there's no polar or negative sense to them, and it's also non-segmented. A, what is A for? Icasa. Okay, they're all icosahedral except for one. What are those two exceptions? All right, one exception is B1 line, B19, parvovirus B19, B1 line. It's not double-stranded. Then poxviridae, all right, that sucker is huge and complex. It is not icosahedral, therefore it cannot go in and replicate within the nucleus like most others. It has to stay out in the cytoplasm and replicate, okay? So pox virus. Name the segmented DNA viruses. There are none. They're non-segmented. It's what the N stands for, right? Name the positive sense ones. There are none. It's what the other N stands for, right? Non-positive or polar sense. Name the naked ones. All right, so you have a pap smear. You get a pap smear when you're naked, right? All right, so here we go right here. You have these, all right? So do y'all remember what those are? Remember, I said I like to say pardon all pappies, okay? That gives you parvovirus right there. Okay, you're going to have the A for adenovirus, and then you're going to have pappies, all right? There's two of them because you're going to have papilloma virus and polyoma virus, right? So pardon all pappies. And you'll run and remember that for this. The reason I don't use pap for a pap smear is so you don't get the pox confused in there. All right, that just kind of helps keep it all straight for me. Remember papoviridae though, that's going to include polyoma virus as well as the other polyoma virus, and the papilloma virus. Next up, let's name the circular ones. Okay, what are the circular DNA viruses? The two cojones, right? You got the HBV. All right, and then you have the papoviridae, which is once again the polyoma and the papilloma, right? All right, let's move over to RNA now. So RNA, give me the double-stranded ones. There's only one, right? Double-stranded, the two wheels, right? Rotavirus over there in Rioviridae, right? Only two. There were two wheels in that picture, right? All right. Name the segmented. Okay, the segmented. Remember the Rio Verde, remember the river was segmented there, okay? And so what you can do is you can remember bores, all right? And so that's for Bunya virus, orthomyxovirus, arenavirus, and then an R for Rio Verde, and then the S is for segmented to help you remember that, or you can remember Sabor. All right, S for segmented, you have the arenavirus, the Bunya virus, the orthomyxovirus, and the R is for Rio Verde. I think I said the R was for RNA on the last lecture. I apologize. I forgot there actually is one more. So you put that R in there for Rio Verde. All right, name the naked ones. Naked RNA viruses, y'all. Okay, the non-enveloped ones, if you remember, are all in that picture. I told you every single RNA naked virus was in that picture. It's best to just go ahead and remember CPR, okay? So you have C for Kalichi virus. You had the P for Picorna viridae. You had the R for Rio viridae, okay? CPR, that's the naked ones. I think pardon all the pappies for the DNA ones that are naked. Pardon all the pappies, they're naked, but they still need CPR. Okay, that's the way that I do it. Anyway, name all the positive sense ones. All right, here we go. All the positive sense RNA viruses. All right, the way that I remember all of the positive sense ones is I'm thinking, yo, this is truly positive. This is cool. I'm going to a retro toga party in California with Flava Flav. We're going to drink Coronas and eat picorna sauce, or you can say popcorn or whatever. Just put pea and corn in it, right? Okay. So for me, I'm just like, yo, this is totally positive. It's pretty cool. Going to a retro toga party out in Cali with Flava Flav. We're going to drink on some Coronas and, some picorna sauce, okay? It's all your positive sense ones. Bam, you're done. Now, name all the circular ones. Okay, remember omas, be bad, right? All right, so your two omas, which are polyoma and papilloma. B for HBV. D for HDV, B for bunyavirus, A for arenavirus, and that will conclude our viruses, folks. It has been a joy, and by all means, feel free, go and donate your $3 to joeyjohnsondo.com. I appreciate it. Talk to you guys next time.